The East Carolina University College of Nursing has been in existence for 60 years. Within that time, we have lots of stories, achievements, and recognitions that we'd like to share with you.
My experience here as an undergraduate in 1975 through 79 was somewhat unlike the traditional residential college student. My world was more defined by my community, my local community, and the world at large.
My journey began with rural roads and being behind a pig truck, and I would always remember that, okay, before I'd hit the highway to get to Greenville. Once I arrived for a 3 o'clock class, I was there until probably 9:30 at night, and then would go home. So long days, but the College of Nursing was small. The graduate program was small. Classes were also, fairly small. Remember, no cell phones, not a lot of technological devices other than, computers. But even that was kind of brand new to us, even in a graduate program. And our classes, we wrote by hand, handwritten notes, handwritten materials.
The things that stick out, and I have some examples, or more related to the people, the patients that I saw, those life experiences for an 18 to 21-year-old who leaves suburban Philadelphia area and comes to Eastern North Carolina. There were some real eye-opening experiences.
I think that the teachers were the thing that I was most impressed with, because as we do today, we had some great teachers.
My experience as a student in the PhD program was a very eye-opening experience. As a nurse for many years and also a nurse educator, I came into the program knowing I had a lot to learn, but thinking I already knew quite a bit, and very soon realized there was a whole world that I had no clue about.
What I remember most about the College of Nursing are my first days as a nursing student back in the early 70s, coming on campus, going to the Rivers building, and being so excited to be a student in a school of nursing that had such a prestigious reputation.
One of the most impactful things that happened to me while I was at the College of Nursing was being able to facilitate an event with Dr. Jean Tranbarger, who was a pioneer for men in nursing, and Dr. Grant, who is the current and first African-American male president of the American Nurses Association.
All of the nurses that I've worked with that have graduated here were impressive. When you come here, you don't feel like they're trying to weed you out after you've already been accepted. You feel like they're trying to help you become the best nurse you can be.
I think there are many things that have been notable about the College of Nursing. I think in recent times, and when I say recent times, I'm thinking about the last decade and perhaps a little bit more, but the phenomenal growth in the enrollment in the college, the faculty, our staff that we have, that's been absolutely amazing. And we now, of course, are the largest producer of new nurses of any college or school of nursing in the state. And that's something we're proud about, because there's a huge need in the workforce for nurses prepared at the level that our nurse graduates are prepared.
Just becoming the College of Nursing was really amazing. How they, how the whole medical part over there has kind of done a whole lot of changing. But every time we go down, when they first got the new building out by the hospital, that was really exciting. And then a couple of years later, they have a new name and new things that they're doing. So I just think it's a really a wonderful thing.
When the School of Nursing became the College of Nursing, we requested that change in status because it really brought some more prestige to the college. It made us more comparable with the colleges on East Campus under academic affairs. It was part of the funding mechanism that we used, so we felt like we were on more of an equal footing with the other colleges.
Since I graduated the program at the School of Nursing, I would say the profession of nursing has changed rapidly. I mean, it always changed. It's just, everything we learn and research is always changing, and, different standards and procedures, medical diagnoses. But just within the field of nursing, we never did telehealth visits. And now it's just sort of standard, and our patients love it.
7 months into my career, a lot of the stuff that I'm seeing that is the same is the stuff that I was taught through ECU's program. ECU, in my personal experience, has done a really good job at keeping up with current practices for nursing and teaching the best way to do things and best practice. And I found that a lot of the stuff that I was taught is being actively used in terms of nursing practice.
And what has not changed is anatomy and physiology. The bodies are still the same. We know a lot more about them today, of course. And pathophysiology. And of course, today we know so much more about different pathological changes in our bodies.
I think the most surprising or interesting changes that have occurred in the College of Nursing over time really, again, is technology. All of our courses now at least have some type of online component, even those that are primarily face-to-face. And also the use of simulation. Back in the beginning of the College of Nursing, or what was school, we had one lab. And now in our new health science building, which really is not new anymore, we moved here in 2006, but we have 8 simulation labs with lots of high fidelity mannequins, so students really get the real world experience in the College of Nursing before they go out into a healthcare setting and can feel very comfortable about their skills when they go forward. So I think those have been some of the major changes that I've seen in how we educate students.
I'm very proud of the new programs that we've started and how well they are doing. They're all quality programs and they are all well enrolled, and they're serving a great need for our community and our state and our nation.
As a nurse at Vidant, I have the opportunity to work with many of the new pirate nurses, and the growth and diversity that I have seen really has shown that ECU is on the right track.
The skills that I learned within the doctorate program at ECU has allowed me to be more confident as a leader. It has given me skills to reach out within the community outside of my organization to make change within the community as a whole.
There are growth opportunities for us in the College of Nursing. I think our focus has always been on meeting the needs of the region, and most recently we added the psych mental health nurse practitioner option because we know there's such a need for mental health providers in our area and really nationally. So I hope that we will continue to focus on meeting the needs of the healthcare needs of people in rural areas and underserved areas, not only in Eastern North Carolina, but really globally as we look at that.